Okay, I think we are going to get started here. So this is our 11th webinar for the post-active treatment surveillance in prostate cancer special study. As a reminder, this is our last webinar that will be 1 hour. The rest will all be 30 minutes. And we are going to cancel the July 4th webinar and the July 11th. But the rest will still be on Tuesdays at 11 a.m. Central Standard Time. So the study progress as of today, so the number of patients submitted as eligible, so far 28,056 patients have been submitted as eligible. The number of sites that are completed with the study is 83, and the number of sites still working are 762, and the number of sites that have not started is 298. So we thank you for all your hard work on the study, and we hope that you all can start completing all your patients soon. So for patients who have received curative intent prostate cancer treatment, that's the purpose of the study, is that we want to determine more frequent PSA testing leads to better survival or more harm for the patient. And in order to answer this question, it is important to know every PSA test that the patient had and to know exactly how frequently a patient is having PSA tests and to know if the patient has had a recurrence. So our goal was to have each site complete 12 patients for the special study. Monitoring has shown a higher than expected rate of ineligible patients, so our sample size seems to be much lower than initially projected. Only the patients who are treated with either radical prostatectomy or radiation for prostate cancer are included in the study. So we have made the study modifications which are necessary to reach the projected sample size. These changes went into effect on May 30th, and we will not be making any further changes. So the first patient eligibility question for the requirement for medical records will decrease from 5 years to 3 years in the first patient level eligibility criteria question for is there evidence that medical records are available for this patient for 5 years or until distant recurrence or death. So now it will be 3 years. The replacement patient queue will include patients diagnosed in the years 2008 to 2010. Previously, only patients diagnosed between 2005 and 2008 were included in the study. These changes went into effect on Tuesday, May 30th, and the updated instructions version 2 is on the website and the web form and will not be mailed out. So the new deadline is August 28th, 2017. So sites that completed the study prior to May 30th will not be affected, and the 2008 to 2010 patients only affect the replacement queue when a patient is submitted as ineligible. Previously submitted cases will still count towards the 12 total, and additional cases have already been added if the site had less than 12 patients, but sites are not required to submit more than 12 patients. So thank you so much for asking the questions either to the special study email or on the webinars. Many questions relate to, is the patient eligible? So what if a PCP is identified but never did the PSA workup? If you have the records of the PCP and there are no PSAs, the patient is still eligible. And if the PCP's office responds but the urologist's office will not respond, that patient is ineligible since we want to get the PSAs from all possible providers. PCPs might have checked PSAs, biopsies, scans, etc., and it would be important to enter all of this information if the PCP checked these items that are relevant to the study. It is recommended to wait 2 weeks once the template letter is sent and the office is called to hear back from an outside facility before marking a patient ineligible. So the key question is, do you feel you are able to record all of the PSAs a patient has had after treatment. And that's not only all of the PSAs from the urologist, it's all of the PSAs from the urologist and the primary care physician and the radiation oncologist if applicable. So 3 years is required for a patient to be eligible, and once they are eligible, we ask for 8 years of follow-up starting at the surveillance start date. So for eligibility criteria, there's 3 questions that we have you answer. Evidence that medical records are available for the patient for 3 consecutive years or until distant recurrence or death, whichever is first. Patients who have had primary radical prostatectomy, the patient's urologist and primary care physician can be identified. For patients who receive primary radiotherapy, the patient's radiation oncologist and urologist and primary care physician can be identified. The patient has at least one PSA test result within 2 years after the end of the primary treatment, and the registrar is confident in capturing PSA information for 2 years after the primary treatment completion. So if any eligibility question is answered no and is submitted, a new patient should automatically be added to the list once the page is refreshed. Please wait at least 2 weeks to hear back from the outside office for the record, and please mark the patient ineligible if the outside office does not respond after multiple requests. If the patient does not have a PCP, then the patient is eligible. If you do not know the patient has a PCP, or if the patient has a PCP but you are not able to get the records, then this patient is not eligible. A complete record for 3 years is needed for patients to be eligible. However, it is possible that some patients did not have PSAs every year. Only the questions on the web form are required information for the study, and patients receiving care at the VA for prostate cancer or prostate cancer follow-up are not eligible. So for PSAs, please enter PSAs until the time of distant recurrence or death or until the end of the surveillance period, not at biochemical recurrence. Please round the results to the nearest tenth. Registrar should follow the Ford's manual, and that's version 2016. So example for a PSA of 1.2, the registrar can enter 0, 1, 2, or 12. Numerically, these are identical numbers and would not affect the study or data analysis. So except when a patient has a result of less than 0.03 or less than 0.01 or less than 0.2 or less than some number, please enter the result as 0 for the special study. In this sole instance, we differ from the Ford's manual, and the example was given in the instructions to specifically show this. So for testosterone, please enter 8 nines if a testosterone test was performed, but the result is completely unknown, and this can be seen on page 45 of the instructions document. This was one of the changes that was made to the instructions, and we have added that. When the doctor indicates possible recurrence and a treatment starts, this should be considered recurrence. So the date of the recurrence should be the date of the doctor's note. The term salvage radiotherapy indicates a recurrence, and after definitive radiation treatment, if cancer is shown in the TUR pathology, please record as a local recurrence. So all instructions in the special study instructions document are for the special study only. Boards should be used for routine data collection for the NCDB. Specifically, the instructions for coding biochemical recurrence and the patients who are never disease-free instructions differ from the Ford's definitions and are only for the special study. So do not update the NCDB with recurrence differences. We realize this is different from the Ford's manual. If you find a patient has had a recurrence by Ford's definitions and that recurrence was not previously recorded in the NCDB, then please update the patient's NCDB record with that information. And please check with your specific registry softwares when you are doing this. So if error messages appear when using the data link's credentials when logging into the web form, please use a lowercase if there is a capital in the password. Once a case is submitted as ineligible, it will automatically be replaced and will not appear on the patient list. If changes need to be made to a submitted patient, please email specialstudy@fax.org. And we ask that you include the special study IDs if you are talking about a specific patient and the FINs in all your communication. So we have plenty of forms of study communication. So the first is our special study website. We also are posting documents and webinars and other important information on the Cancer Forum and the Standards Resource Library. Please send all study-related questions to specialstudy@fax.org. The special study-related questions sent to personal fax accounts will be forwarded to the special study address. So either send an email through the contact form of the website or email the specialstudy@fax.org email address. Please do not send both, as all of the emails go to the same account. Please include your FINs in all communication because that is how we can identify your site. So emails for the special study are being sent from the specialstudy@fax.org email address through an outside server. And if you have not been receiving these emails, send the following information to your IT department and ask them to put us on the wait list. So for the IP address is listed here. And then here is all of the NCRA program recognition information. So far we've had 11 webinars, and these are all worth 1 credit hour. So, and this will be the last one that is worth 1 credit hour, and the rest from now on will be from 11 to 11:30. So they'll only be 30 minutes long and worth 0.5 credit hours. So updated instructions document version 2 is available on the study website and the Cancer Forum. Questions from the previous webinars and the Cancer Forum will be included on all webinars. If the site is complete with the study, attending the webinars is no longer necessary unless they need the NCRA credit. So now we will review frequently asked questions from previous webinars. So for recurrence, what PSA level should be used to classify as patient having recurrence? We are not asking registrars to interpret the PSA results, so please record recurrence if the clinical notes indicate a recurrence and or if a patient receives treatment for recurrence. So does the patient have recurrence if he was never disease-free after treatment? For the study purposes only, yes. Please record the date of the first PSA test after the primary treatment as the date of recurrence. Never disease-free can be noted as progression of disease or persistent disease after treatment. So are sites automatically compliant with the standard for submitting cases to the study? For standard 5.7, yes, sites that submit all the patients by the study deadline of August 28, 2017 are compliant with standard 5.7. If the urologist and the PCP are retired, please see if it's possible to collect the records from their offices. Often the physicians might have retired, but the records are still available. All of the NPIs are required for each provider that saw the patient during the surveillance period. If the NPI on the surveillance tab is unknown, please enter zeros if there's no provider, the nines option if they have the provider but the NPI is completely unknown, and the sevens option if it's unknown whether they have this provider. So comparing what information the NCDB tab has for a patient to what the medical record contains, there is more information available in the medical record than was initially abstracted. This is especially true for Gleason on prostatectomy and the date of last contact. Please select No and fill in the updated information. We are looking for the most current data, so please use Ford's 2016. If the NCDB fields are blank, please enter the correct information. So some fields were not collected until 2010, so allowable values for Gleason patterns are 1, 5, and 9 for unknown, which are different from Ford's, and the web form will not allow for blank answers. So for pathologic T and N, if the answer should be changed to blank, please enter 88 for the special study only. If they are already populated as an X, there's no need to change it to an 88 since that's correct. It's only if you need to change it to a blank from a different option. Okay, and then I can go back to the communication slide. And we can start answering the questions that we've received on this webinar. So registrars can go to other registrars at other facilities to find information, but we also going to the medical record staff is also perfectly fine. Biochemical recurrence should only be captured in the field for the date of first recurrence detection by any method and only if the physician states it in the notes. So for the definitions of local, regional, and distant recurrence, all of these are defined in the instructions manual. So for example, if the patient does not meet the definition for local recurrence, then please enter no for local recurrence, and same for regional and distant recurrence fields. So there's no need to attend the webinars if you have submitted all your patients. That means you are finished with the study unless you need the NCRA credits. If you are done with all the cases, no changes should apply afterwards. There haven't been any changes other than the May 30th changes since the study is going on. So if you're not getting any responses from urologists, and that would make all your patients ineligible, is there any protocol to get the information from old EMRs? If they use a hospital or a hospital EMR, then you may be able to request records directly from the hospital. If they keep all of the records in their office only, then unfortunately they would need to provide the records. So the NPI numbers did not automatically populate over from the NCDB, and we are asking the registrars to manually enter the NPI numbers. So if you know for a fact that the patient does not have a PCP and you have all of the records from the other providers, then they are still eligible. If something is left blank that should be filled in, will you get an error when you try to submit. So yes, the web form should not allow you to submit if information is complete. The web form will not exactly tell you where the errors are, but it will not let you submit until everything is entered into the web form. So the special studies are not voluntary. If you, you the prostate special study of 2017 is required in order to fulfill standard 5.7 for 2017. If you do not do the prostate special study and you are not exempt, then you will receive a deficiency for 5.7. So if there's a urologist who has the majority of the patients and they are not answering calls, faxes, mailings, and emails, can you mark them as ineligible and get 7 new cases? Yes, this may be necessary, but there's no guarantee that your replacement list might run out. So, and we ask that you have 12 eligible patients. So right now, I think we've reached the end of the questions that have been asked today. We'll still be on the line and answering more questions as they come in, but if there's any silence right now, that's because there's no more questions. So if none of your cases are eligible, you would still receive credit for standard 5.7 since you did the work to determine the eligibility. So if you have questions about deficiencies, those should be directed to the accreditation team at the COC. So um, we ask that you determine eligibility for all of your patients, and even if they are still um, ineligible because you can't get records from an outside facility, we ask that you just mark them ineligible one by one in case you might get a patient who is eligible. So it is possible that some facilities might not have 12 eligible patients. If that's the case, then the facility is still compliant. So if urologists are requesting monetary charge for the records, please check with your cancer committee chair to see if you have any funds, and if not, please mark them ineligible. So we advise that you please wait 2 weeks for the records before marking the patient as ineligible. So the webinars do not count for Standard 1.1. We are only offering the NCRA credit, and they are counted as national webinars. I can go back to the screen with the NCRA numbers. So if we said that 3 years of information is required for a patient to be eligible, and then we ask that you provide 8 years of follow-up. If you only have 4 years, then that patient is still eligible. Um, we ask that you provide as much follow-up data as you have, but stop at 8 years. We can go back to the slide with the number of sites complete. I can go to the communication page. The slides are located on the special study website under instructions and resources, and then also on the Cancer Forum in the Standards Resource Library. And they should be in PDF form. The old webinar should be on the website still too. You can enter the NPIs on the same line. So for example, the urologist and the primary care provider can be on the same line, but each column should be its same specialty. If the patient only has 3 years of information and has expired, are they still eligible? Yes. So as long as they have one PSA test result within the first 2 years, then they're still eligible. So if there's 5 years of follow-up information for a patient and then the patient moves and there's no information on the new physicians, is the patient still eligible? Yes, the eligibility question is at least 3 years of information, and then we ask that you can enter whatever you can get between years 3 and 8. So for the confidence question, please enter for how many or whatever data that you have on the web form. So there's one confidence question related to PSAs and another confidence question related to scans. So for each question, please enter your confidence for all years of the data that is entered. So today's slides should be available later today and by tomorrow at the latest. You won't be getting any hard copies of the presentation or the PowerPoint. Everything's electronically on the website. So for surveillance scans, are we to enter all the scans, for instance, limb pain as they undergo an L-spine CT? Only scans or limb pain could be related to prostate cancer, recurrence, or metastasis, so please include this scan. We would like to have information on all scans that are related to prostate cancer or recurrence. So there's no way to know what was left blank or entered incorrectly without checking each tab. So we ask that you make sure that you are entering each tab correctly. The web form will have an error if you're trying to submit something incorrectly, but unfortunately there's no way to know where the error is. Okay, I think that's all the time we have for today. So thanks for everybody who called in, and thanks for everyone who asked questions. If you have any further questions, please email specialstudy@fax.org, and we can answer you through email. So we will see you next week, June 27th, and it will only be a 30-minute webinar.